here today with a very special guest, Dr. Peter McCullough. Dr. McCullough, thanks for joining today.
Thank you.
You are a truth speaker. You have taken a lot of hits in your career recently through COVID to speak the truth. Can you tell our audience a little bit about your journey and what inspired you to take those risks?
I'm a practicing internist and cardiologist in Dallas, Texas. I'm also a research epidemiologist. Before the pandemic was really top of my field in studying the interface between heart and kidney disease. But when I saw this pandemic roll in and saw, how severe the infection was for some individuals, particularly our most vulnerable, and then I saw the main response being new genetic vaccines, I thought both the infection and the vaccines offered a tremendous peril to the population. So I had to step in and take action.
What kind of backlash did you face for that?
Well, I've been through 3 jobs with, the ends of them being for no specific reason. Been pursued by, a variety of pro-vaccine journalists that have put out hit pieces, in the popular kind of physician media. But at the same time, I've prevailed. I have, some of the highest tallies of COVID-19 pandemic peer-reviewed published manuscripts that exist right now, including the 2 biggest ones. The 2 big things people wanted to know is how could they avoid hospitalization and death, and that was published. The publication of the McCullough Protocol in the American Journal of Medicine in 2020. And then they want to know years later how they can deal with the toxic effect of the vaccines. And that was McCullough Protocol-based spike protein detoxification published in the Journal of the American Physician and Surgeon, as well as the Springer Nature Curious Journal of Biomedical Sciences. So what I've done is I've led through publication, I've led through my leadership, and the detractors quickly fall to the side.
What made you take that risk when so many doctors just went along with whatever the common media was saying?
Well, I was doing the right thing, right? So patients want doctors to find solutions to problems. They want doctors to step forward in the time of a medical emergency, a pandemic crisis, and show leadership. The real question is, what happened to everybody else? I mean, where was the chief of medicine at Harvard to announce the Harvard protocol to help people avoid hospitalization and death? Or how about Mayo Clinic? Or how about Baylor in Houston? How about UCLA, Emory? We should go around the country. And these institutions had showed no innovation, no creativity in terms of their approach to the problem, no special solutions. And then none of them have shown any leadership on the whole topic of vaccine injuries, disabilities, and deaths. None of them.
Well, we've had a few years to reflect on that question. Where were they? What were they doing? What is your response to that? What were they doing? What were they thinking?
Well, when I ask colleagues about this, the typical response is, "I don't want to talk about it." So the orthodoxy really does not want to talk about this colossal failure, the failure to treat patients and help them avoid hospitalization and death with COVID-19, and now the failure to screen and detect, diagnose, risk stratify, and then treat COVID-19 vaccine injuries, disabilities, and deaths. See, these are 2 huge areas of internal medicine and infectious disease, and turns out so much of it is cardiovascular. There are some neurologic and autoimmune syndromes. But when I talk to my colleagues, they say they don't want to talk about it. They have no answer. They don't want to engage in dialogue in the meetings. There's no presentation on this. It's almost as if the medical community wants to forget about COVID-19 and the vaccines altogether.
Which makes me wonder, to what extent are they complicit in it?
They're completely complicit in this. I mean, it was the responsibility of our major marquee institutions to show leadership. Just think about treatment of acute COVID-19. Not a single one of our over 300 medical schools had their own unique protocol that was going to improve upon the U.S. government base protocol published November 8th, 2020. That's astounding. that nobody could do better than a basic bare bones government protocol.
Okay, so that just doesn't seem like a coincidence. How could they be so much in lockstep with that? I mean, just breaking all precedent. I mean, was there some sort of like memo that went out to all these 300 schools?
Yeah, I was at a big medical center. There's no memo that came, when I was in place, and um, you just have to ask a chief of medicine or a chief of infectious disease. What was it? How come you got up to bed and couldn't even swing the bat? How come? Why not even try? And most of them just have no answer. They turn their heads, they walk away. They don't want to talk about it. It's a colossal failure of medicine.
Well, from the way you're describing it, it sounds like there's not even this post-event reflection on, well, what can we do to improve?
No, yeah, well, that's a very important point. There are no grand rounds about pandemic uh, response lessons learned. Yeah, I'm on a standing committee in the Arizona Senate, and I have really encouraged our committee and the Arizona Senate at large to call a meeting of the health system CEOs and the chief medical officers and do a review of how did the hospitals do? What were the comparative mortality statistics? Who kept patients off the ventilator alive and got them home, and who didn't? And let's hear from the hospitals that were most successful. What did they do? And so we can all learn if there's another crisis. But what the senators tell me is the hospital CEOs and chief medical officers will not show up to such a meeting.
I'm so baffled right now. I don't even know how to articulate my thoughts other than just repeating the questions I've just asked you.
It's just mind-boggling. Are you down in Houston?
That's right. Yeah.
Right. Okay. So you have Texas Medical Center there. I'm in Dallas. You have some of the leading hospitals in the world. And here we are in Texas, one of the most populous states in the entire country. There still is no hospital in Texas that claims to be a center of excellence for COVID. Not a single one claims to be any good at treating COVID. I mean, this is astounding. Not a single one claims to have any expertise in handling vaccine injuries, disabilities, or deaths. Like I say, it's mind blowing. It really is. And so, my office is full every day from patients who've gone from center to center to center. And we know that, by the way, that the real damage from COVID and from the vaccine is the spike protein. Spike protein is the spine on the surface of the virus. And when they go to the marquee institutions, they don't even measure any tests that indicate how much spike protein is in the body. It's a complete blank. I mean, there are research papers written about long COVID and vaccine syndromes where they measure all these factors regarding inflammation, but they never measure the spike protein, which is the cause of the problem. And so we have really an enigma here. We have something that is very, very big in medicine right now. It's a blank spot, and the blank spot just continues to grow in space and time. And the Biden administration spent $1 billion on long COVID syndromes, $1 billion, and they didn't even measure the spike protein of the virus, the fundamental part. And so you can imagine if they don't measure or assess for the fundamental problem, you can see that they would make no progress. And it's true, the Biden administration long COVID program accomplished nothing. No new protocols, no new drugs, no new approaches.
I feel like we're living in a dystopia. When you read these totalitarian histories, the common trait is the vast majority remains either ignorant or silent out of fear. And that's, I mean, how can it be that there's just so much silence on this topic? That silence is deafening when there is established research out there and you've been effective clinically in helping people with this. I think this is just one case study, but I hope it opens people's eyes to how effectively people can be silenced.
I'm not sure how much of this is being silenced, that these good doctors have plenty of solutions and they wanted to do all these good things and they're just being silenced. Or are they in some type of psychological trance? What Matthias Desmet describes as mass formation. Because I really think doctors are good people, and nurses are good people too, and they wouldn't just abandon their patients like this because of fear or because of money or what have you. I really think there's some type of deep psychological trance that people fell into, and we have to study it. It's a very interesting phenomenon. I can't explain it. At this point, 5 years into it, all the doctors who didn't treat their patients early for COVID and their patients died of COVID, they must have tremendous guilt and remorse. They have to. I mean, we've published, many, many reports that COVID-19 was readily treatable with a whole variety of drugs early. For 2 years, we had no oral drugs. Paxlovid came 2 years into the pandemic, so we had to use something other than Paxlovid. And then for the doctors, which is the majority, that supported or promoted or even mandated the vaccines, almost certainly they took the vaccines themselves. Their family members took the vaccines. They pushed it on their patients. And now we see just what's nothing short of a horror develop in terms of vaccine injuries, disabilities, and deaths. These doctors must feel gut wrenching nausea and anxiety and remorse about what's happened. And it has to be so deep psychologically. The only defense mechanism they have is, I don't want to talk about it. I can tell you the public knows that when I give large public programs, and I've given hundreds of them, I ask a question: how many of you know someone who's been injured, disabled, or sadly died of a COVID-19 vaccine? 85% of people raise their hand. Everybody does. I bet you do. Do you know somebody who's had a problem with the COVID shots?
Well, thankfully, a lot of my friends didn't get the shot. So I didn't get the shot personally, thanks to Attorney General Paxton. He protected. I was actually doing an internship at Baylor at the time, and it was required. They, I was able. There was an exception for students, although the HR officer wasn't even aware of it. I had to show them the Attorney General's notice in order to get out of taking the vaccine. People didn't even know about it.
They
I think
didn't
I
even
was
know
They
about
didn't
that.
even know
Wow.
about it. I didn't. I don't know anyone else at Baylor who didn't get the vaccine. So
Yeah, my son was at McGovern, UT Houston School of Medicine, and he, didn't even ask me. He took a total of 3 shots.
did you get the
So,
vaccine?
no, I didn't take it. Oh, no, but my son did. And, he didn't even ask any questions. His wife took it. And you're right. It'd be hard to find somebody who didn't take it. When I went to his graduation, now this was a couple of years ago, and his class, was the class that where the COVID swept in and shut down the anatomy labs and all the research labs, and it greatly affected their medical training for sure. And I went to his graduation down at Texas Medical Center, and there was no mention of the pandemic or the vaccines in any of the speeches, as if COVID never occurred.
That's incredible.
Yeah. So there's going to be a giant whitewashing in history. Right now, we have 12 studies showing since the vaccines rolled out in 2021, all-cause mortality is increasing. After a pandemic, mortality should decrease, and
Because
it's
the
increasing.
weakest members have died, or
Right, right. The
right?
most
Okay,
frail people at the end of their lives have died. You're exactly right. We have 4,000 papers on vaccine injuries, disabilities, and deaths. We have, I published a paper from the McCullough Foundation using the Seattle cardiac arrest data when Seattle's nearly 100% vaccinated as a city. When they rolled out the vaccines, cardiac arrest skyrocketed. And because we know the vaccines cause myocarditis or heart damage, that's proven. It's in the package label for Pfizer and Moderna. They cause myocarditis. Myocarditis, it's proven, causes cardiac arrest. So this causal chain exists. I mean, this is unequivocal. And yet there's no interest, there's no outrage. The cardiac arrest happened. Everyone just notes more people are dying without any reaction.
that's incredible. Well, you were talking about how it was 2 years before this oral medication came out. But I mean, I remember this time very clearly. I know I have a close friend who's a physician, and I remember during that time, if you recommended anything other than a vaccine, you were a conspiracy theorist.
Remember, vaccines are not treatment. Vaccines don't treat the acute problem. So we should have always had a focus on early treatment. Vaccines are always secondary. They're not primary. Remember, we should never vaccinate into a widely prevalent pandemic. That's a general principle of vaccinology. If we do so, we're going to generate resistant strains of the virus. And that's exactly what happened. So the vaccines were a bad idea as a primary solution. A very bad idea. The primary solution should have been early multi-drug treatment protocols, getting people through the illness. Once somebody already had bona fide COVID-19, the next infection carried a 0% risk of hospitalization and death. So it was all about getting people through the first episode of the illness. And then if vaccines had a role, it would be much later on, very restricted group, maybe nursing home patients and workers. But it would never be a primary strategy that would be applied for 4 years down to 6-month-old babies. I mean, anybody looking at this would have to think, man, the public health strategy was way too monolithic and was in many ways just a complete expression of vaccine hubris.
Well, and it was worldwide. It's not like this just happened in one country, but this was the lockstep motion all across the world.
Yeah. Yeah, the whole world was coordinated. And Lisa Myron, who's been on my show, an investigative attorney from Toronto, has reported on the national focal points. There's 193 member nation, over 140 national focal points for the World Health Organization. Ours is called PAHO, Pan American Health Organization in Washington. Well, it turns out they coordinated messaging all over the world. So one day in before the vaccines in 2020, there was a message that went out worldwide, simultaneously, all at once. You can see montages on Twitter where it's spoken in dozens of languages across multiple stations, all at once on the same day. And that message was, "No one is safe," like a fear-based message. And then another one in
It's like something from
2021.
1984.
Right. Another one in 2021 was the message was, "It's a crisis of the unvaccinated." And it came out all at once. Even Ron DeSantis, the governor of Florida, was out. "It's a crisis of the unvaccinated." I mean, what got into people's minds to give the same talking points all over the world? I mean, who would actually issue the suggestion that you should say give this talk?
So you're saying, according to this journalist, it is from the World Health Organization,
Yeah,
and then
she
it's
said.
alive.
He said that's the only place it could come from because they just have the communication system worldwide for this type of thing.
So you mentioned that not a lot of light has been cast on the spike protein, and my understanding is the spike protein is the location of the furin cleavage site, which points towards the gain of function research. So I wonder if that could be one reason why people are not advertising that.
Well, good point. So again, this is the virus. Remember, the virus is a beta coronavirus. The spike protein is about 1,200 amino acids. I think it's about 3,800 base pairs. It's got the furin cleavage joint between S1 and S2, what's called the receptor binding domain. And when the virus comes into the body, it locks primarily to the ACE2 receptor. There's a secondary receptor called TMPRSS2 that can utilize this. The S2 segment is sacrificed because the spike protein folds. S2 is sacrificed and S1 gets into the body and the virus gets into the body. Well, if you've had the COVID infection, almost certainly you have S1 in your body. It's Bruce Patterson at IncellDX has found CD16 positive monocytes have S1 for about a year and a half after the infection. For example, Brogna and colleagues have found after the vaccine, which is the genetic code for the full-length spike protein, which is held open by Pfizer and Moderna by proline inserts. Pfizer and Moderna used the same method to hold the spike protein open so it wouldn't interact with the ACE2 receptor because there is some receptor-mediated catabolism. So S1, S2 float free in the bloodstream. In fact, it trimerizes into 3. It twists into triples. And Brogna has found this circulating in blood for up to 6 months in half of vaccine recipients, and now a paper from Yale has found it out to 9 months. Can you imagine you take a vaccine and you have circulating spike protein engineered in a Wuhan biosecurity lab in your blood for 9 months? The doctors have to be reading this literature, and they have to be uncomfortable.
So what is the possible impact of that?
Well, spike protein for sure is found in blood clots. So one of the biggest things I see in my practice is blood clots. Someone took the shots in 2021. They developed significant blood clots in 2025. I mean, that's a routine observation. Spike protein circulates, it goes to the heart. The heart is one of the most oxygen avid tissues in the body. Spike protein causes myocarditis or heart damage. And on a low level, it can do so for many months or many years. It's called subclinical vaccine myopericarditis. And the great concern here is that it can be the smallest patch of inflammation that can trigger a cardiac arrest. And cardiac arrests typically occur with a surge of adrenaline, either in the waking hours of the morning, 3 to 6 a.m., or during sports. So as we sit here today, the next cardiac arrest that happens is likely due to the vaccine, if the patient took the vaccine or not. I testified in Congress. I said, listen, I think this risk is going to exist for the next 5 to 15 years for the vaccinated.
Wow. So just to clarify, what is it about? Because the COVID virus itself has the spike protein. What is it about the vaccine that exacerbates that?
Well, the COVID infection itself does contribute some spike protein in the body, but it's the S1 segment. It's just the outer tip alone with the infection.
Uh-huh.
And then it's much less spike protein. If you have really good defenses in your nose and mouth and use nasal sprays and gargles, you can get it down to hardly any spike protein exposure. The vaccine inserts the genetic code for the spike protein, and it's produced endlessly, and it just accumulates in the body.
Wow.
And we know the spike protein from the vaccine must be a greater load on the body because we measure antibodies against the spike protein as a proxy for how much antigenic mass is there. With the infection, a typical person's had the infection like you, your anti-spike antibodies are probably less than 1,000. If you would have taken 2 shots of Pfizer or Moderna, you could be at 10,000. If you took a booster, you could be 15 or 20,000. 4 or more shots, you're almost certainly over 25,000 units per ml on the Roche Alexis system. So the vaccine gives not only the full length spike protein, which almost certainly is more pathogenic than just the S1 segment, but it gives a massive load to the human body.
Wow. That is crazy. I had no idea about that because the way, I guess in principle, the way vaccines work is it gives you like a small dosage to inoculate it. But I suppose technically this isn't a vaccine, it's mRNA technology, which means your body is replicating the genetic code to create the spike protein at a much higher level than if you had just gotten the infection.
Right. Well, there is a vaccine that just gives a limited amount of spike, 5 micrograms of the spike protein. That is the Novavax vaccine, which is virtually never mentioned by our public health agencies, never mentioned by hospitals as an option, but it is an option. And in my view, it's far safer than Pfizer and Moderna.
Why do these people hate humanity so much?
Well, a lot of this is corruption. Senator Rand Paul wrote a letter to CDC Director Walensky at the time when he discovered that Pfizer and Moderna used a marketing firm, Weber Shandwick, and Weber Shandwick had an installed marketing unit within the CDC promoting messenger RNA vaccines.
Oh my
So
gosh.
no wonder Novavax never got the light of day.
Wow. Okay. So is there any current danger of COVID right now? I mean, I don't know if there ever really was much of a danger to begin with, but is there any current danger?
All the young people like you, or even someone my age who's fit and strong, no, the virus didn't play any significant risk to us at all. It largely was a risk for nursing home patients, those in congregate living, those with many medical problems. So we never should have locked down. Everyone should just continue their lives as usual. We would have more rapidly developed, more global population immunity. And if we never rolled out the vaccines, I don't think we would have had the Omicron strain. I think it would have ended with Delta. So we would have basically had about 2 years. But the vaccines have extended the pandemic to 5 years. We're into the Omicron subvariants, KP2 and 3. And it just keeps going and going and going. And we're to the point where I don't even bother testing for it anymore. It's indistinguishable from the common cold. 97% of us have had this. Think about this. The infection affected everybody. So all the efforts to prevent infection, masking, lockdowns, hand sanitizer, social distancing, it was all a complete waste of time and effort. It was very costly because we all got it. All this personal protective equipment and eye shields and gloves and gowns and masks was a complete waste of time. Remember contact tracing? This was a massive effort where people tried to see who they came in contact with someone else. It's ridiculous. No one ever talks about contact tracing today.
Could an argument be made that because it was because the time that it took to spread the infection was lengthened because of the precautionary measures that allowed like the less, I don't know, harmful strains or the more harmful strains to die out or something? Is there any argument there?
Well, I mean, there is kind of this perverse argument that, well, since we vaccinated and we stretched this thing out from 2 years to 5 years, we allowed the emergence of the Omicron strain, which, by the way, did emerge in vaccinated individuals when it was first described. So we had 2 years before Omicron came, and we had 1 year of vaccination. That's the real value of vaccination, was to just get us to Omicron. But by the end of 2022, 78% of Americans had already had COVID-19. I mean, the vaccines, clearly didn't prevent it. They didn't reduce the risk of hospitalization and death. That was never shown in a prospective, double-blind, randomized, placebo-controlled trial, never shown in a valid observational study. They didn't stop transmission. They basically didn't work. So, the one thing was clear is the vaccines did promote these resistant strains. The vaccinated harbored plenty of COVID in the nose and mouth.
This is such madness. So, what one thing that you have a great contribution of, and probably the best one, you have a great treatment for COVID, which I guess is just not really as relevant now that it's gone through the population. But then more interesting treatment for your spike protein protocol for vaccine injury. I wonder. I mean, I'm sure there's a lot of technical information there, but for people who just layperson listening to this, what does that protocol look like?
Well, virtually everybody listening to this has spike protein in your body, and that's not a good thing. So virtually everyone who's had COVID or has had the vaccine is probably going to want to get rid of it. Human enzymes can't seem to break this protein down. As you mentioned, it was intentionally engineered in Wuhan, China. So we've discovered that 3 products in combination, nattokinase, bromelain, and curcumin, these are natural substances available in a capsule format. It's actually in a combined over-the-counter capsule called Wellness Company Base Spike Protein Detoxification. The name of the product's called Ultimate Spike Detox. It's based on my work, McCullough Protocol Base Spike Protein Detoxification, where we demonstrated that nattokinase, which is derived from the fermentation of soy, it breaks down spike protein readily. Bromelain, derived from pineapples, does as well. And then curcumin blocks the inflammation. There may be other products that do so. Serrapeptase, lumbrokinase, and papain come to mind. The triple combination, nattokinase, bromelain, and curcumin, Wellness Company Ultimate Spike Detox, hands down is the choice of people worldwide who want to get this vaccine and COVID out of their bodies. And it's being used in large numbers.
How often do you have to take that, or how much do you have to take that?
Well, the Ultimate Spike Detox, that's the strongest product out there. That's medicinal grade. The minimum dose is 2 capsules twice a day on an empty stomach. I commonly tell people to double that to 4 capsules twice a day. That's going to give 2 capsules twice a day. That's going to give 8,000 fibrinolytic units of nattokinase, pretty high dose. And then, of course, doubling that gives 16,000 fibrinolytic units. And at that level, it is a blood thinner. It's reducing the risk of blood clots. And Jordan Vaughn, who runs the largest vaccine blood clot center in the United States in Birmingham, Alabama, he testified in Congress that he's using 16,000 units a day as his opening dose, as I am, since I'm seeing serious patients. But your audience ought to go to the wellness company, twc.health/courage, and check out Ultimate Spike Detoxification. Most people have had the vaccine, have had some side effects. They need to get on detox. I've never had somebody with a cardiac arrest or new heart failure once they start detox, but sadly, there have been countless numbers of cardiac arrests. In fact, I have a young medical student from Texas Medical Center, severe heart failure, vaccine myopericarditis after taking these shots. And fortunately, he's recovering on base spike protein detoxification. But he had to come to Dallas to see me because no one down at Texas Medical Center would tell him about it.
So definitely people who've taken the vaccine, but even people who haven't taken the vaccine but have had COVID.
I'd say so. If there's any question, you can get antibodies against the spike protein. If it's less than 1,000, you probably don't need detox, but over 1,000, I recommend it. Many people have had COVID 2 or 3 times. I've had a severe case. I guarantee it's going to be over 1,000 on that blood test. Starting detoxification is wise. The Japanese use nattokinase to prevent heart blockages and to prevent carotid atherosclerosis. Bromolin's used as a general health supplement and anti-infective. Curcumin's widely used by the Asian Indians as an anti-arthritic, anti-cancer product. So believe me, just taking these anyway is pretty wise. So why not take them in this pandemic era where people are still worried about long-term problems after the infection, after the vaccine?
Would there be any symptoms that people would notice from having had the vaccine? Like, obviously, if you have myocarditis, that's bad, but or are there any symptoms that you might notice before that?
The most common ones after the vaccine are loss of mental clarity, fatigue, ear ringing is a big one, tinnitus. Um, People have various skin rashes, joint aches, hair falling out, swollen glands or lymph nodes, occasional chest pain, blood pressure going up and down, palpitations, um, numbness and tingling, what we call small fiber neuropathy. It's probably 5 to 10% of the population has a vaccine problem right now. And in the CDC VSafe data, of which 10 million Americans participated in, the rate of side effects, which people had to see a doctor or be hospitalized with the vaccines, 7.7%.
Wow. Would the detox cure those symptoms?
Yeah, it's on my experience that they do. We've publishing the best we can. Young man resolving myocarditis, we've recently published. We need to get into large prospective double-blind randomized placebo-controlled trials, but several thousand patients under direct observation. It's my conclusion that the detox serves as a base. Now, there's some additional drugs we use in particular syndromes, but the detox is enormously beneficial. It's the only thing I've seen that lets the antibodies from the spike protein come down, implying we're getting rid of total body spike.
Okay. So I want to get into now um, some of the interesting things that have developed since you've come out as a truth speaker. What I've been told, and in my personal experience, is you meet more interesting people that you do want to spend more time with, want to be friends with. Once you start speaking the truth in a hostile environment, I'd be curious, what was that journey like for you? Who did you meet, and what inspiration did you take from that?
Yeah, I was, minding my own business as a professor of medicine. I was well known. I had already presented at the New York Academy of Sciences, European Medicine Agencies, FDA, Congressional Oversight Panel. I mean, I was well known in my field, so I had plenty of notoriety. But oh my lord, I went on Joe Rogan, and to my knowledge, I'm still the all-time record holder. I beat Musk several times and Trump, and yeah, I mean,
Congrats, that's amazing.
yeah, there's been more views. It was a mind blowing interview. I went on Tucker Carlson that started him on this journey. He ultimately lost his job. There's perils that people had. I testified in the U.S. Senate twice, and I was the co-moderator of 2 key sessions, and the lead witness testified in U.S. Congress, gave a European Parliament address that became a chapter in a whole textbook. My life was, in a sense, put into it just catapulted me as a public figure. But the other thing it did is, I was always assiduous as a scholar. And I'm now approaching 700 listings in the National Library of Medicine and PubMed. I mean, the average professor down at Texas Medical Center maybe has 25. I mean, I was already top of my field, but what it did is it brought my work to a far more important level. So the McCullough protocol and the promulgation of early treatment for COVID-19 is credited with saving tens of millions of lives and sparing hundreds of millions of hospitalizations. Now, McCullough protocol-based spike protein detoxification is undoubtedly helping. The principles are helping probably hundreds of millions, if not billions, of people worldwide. I mean, this is a stunning impact, and it was a wide open academic landscape. And you think some young doctors at Harvard would want that type of notoriety in their life, that they would want that type of fame. But none of them. They're still to this day on the sidelines, just kind of watching.
Incredible. Well, I'm a psychologist. I really love people and understanding people. What's it like to be talking with Tucker Carlson and Joe Rogan? I mean, Tucker's my hero. I try to imitate him. What are those guys like?
Well, my first observation is, for all these people that you see, they're just regular people like you and me. Most of them are naturally curious. They just want to find out about things, and they want to be treated like an everyday person, as I do and as you do. For the people at the top, though, I would say, let's take Joe Rogan. I would say this, that Joe Rogan, is very intelligent, very well read. He came to my interview with prepared cases. I mean, it really, really researched things, and he he asks questions in a way where he's genuinely interested in hearing the
Mm.
answer.
Yeah.
He has a very nice voice to listen to, and if you study Rogan, you'll see one thing about him. He never interrupts his guest. Never. Now, Tucker Carlson, high energy, penetrating, and he uses a style that gets the viewer's attention. But when I interviewed with him, he said, "You're blowing my mind. I didn't expect to hear this." I mean, these types of things, it really, then the audience is like, wow, I guess I should, be paying attention. So he uses a different technique. I went on a lot with Laura Ingraham. I've been on primetime TV, primetime live TV nationwide hundreds of times. And I can tell you, Laura Ingraham, who I got to know, is, she's appreciative of a concise answer. And a concise answer means another question. And then when she starts to get a little impatient, I can see her kind of, doing this. Because, like right now, I'm looking at the camera. I'm not looking directly at you. Same thing
Right.
on national TV. There's something called the return feed. I can't look at the return feed. I have the producer in my ear and I have to look at the camera. So you have to pay attention to all these cues. And also, I go on Fox Business with Liz McDonald now a lot, and she does the same thing. She likes a short answer. So what I've learned is that being a public figure means, being someone who's obviously true to the science, because I'm creating a tremendous amount of video evidence that
Mhm.
anybody can review. And I've challenged people to say, listen, find a video where I was ultimately proven to be dead wrong on a topic. Dead wrong. Find it. And I've been very careful in how somebody went back to Joe Rogan and said, Dr. McCullough, you said you can't get COVID a second time. I said it was true. It was like 2 days later, the story broke about Omicron and its ability to reinfect those who already had natural immunity. I said, listen, the data change and I'll change with it. But you see these other montages where, remember Rachel Maddow, who says, you take the vaccine, it stops the vaccine in its tracks. You can't get COVID. I mean, she was completely wrong on that. Anthony Fauci was completely wrong on masks, and Deborah Birx. I mean, it's embarrassing for people to be completely wrong and have it all on videotape for evidence.
Well, thankfully, they have a very powerful control of information complicit with them, so they don't have to worry about that. Whereas your words, I'm sure, are studied extremely carefully. Well, with the experience you've had, I'm talking with a not only an expert physician here, but an expert interviewer. I got to get your feedback. What can I do to improve as an interviewer?
You're doing pretty good. I can tell you, you're asking questions to, to learn. And I think it's always good to, as an interviewer, to try to put out something relatable. So let me give you an example. I went out with Liz McDonald, and Fox Business is pay-per-view for all the big Wall Street execs. That's what that show is about. And when I went on, it was on different topics, and I was tackling them the first couple times. And finally, Liz McDonald had me on. She goes, Dr. McCullough, what's going on with these COVID vaccines? One of my friends took one. He was hospitalized with blood clots 2 days later. And I said, well, I thought to myself, I don't need to tell Wall Street the vaccines aren't safe. Liz McDonald's going to do it. So I think it's always good for an interviewer, though, to pick something relatable and tell a little bit about themselves, because there is the power of disclosure. Right.
Mhm.
You did it a little bit later on. You said, "I'm a psychologist," and I kept mentioning psychological principles, what have you, and so, I think the art of disclosure, and of course, it's always the art of letting the other person talk and listen too.
Well, that latter one is easy for me as a psychologist. I cringe at the thought of interrupting someone. But the disclosure, that's a helpful piece because I think if I don't do the disclosure, then it can just seem like an interrogation, and that just doesn't have a good feel to it.
Well, everybody has their own style, but as a psychologist, you can see some of these phenomenon out there. So you're from Houston, so you must be aware of Dr. Peter Hotez, who's in pediatrics at the Baylor College of Medicine in Houston. Now, he's not as published as I am, but he's close. So he's kind of in my ballpark. And I told Joe Rogan I'd be happy to go down to Austin and I'll discuss vaccine safety with Hotez. And Rogan said that he's not going to face you. And in fact, when I testified 3 times in the Senate, Anthony Fauci was invited. He wouldn't face me either, to give you any idea. People really don't want any discussion. But with Hotez, he's published a book, and sadly, he's got a daughter, Rachel, and Rachel has autism. And the title of Hotez's book is "The Childhood Vaccines Did Not Give Rachel Her Autism."
That doesn't leave much room for argument right there, does it?
Well, I mean, what would cause that thought to enter his mind? And the psychological defense mechanism is called projection. Projection. So how we read that is, well, for sure, Hotez is concerned the vaccines caused his child's autism. For sure. Autism was 1 in 10,000 when Hotez and I were children. Now it's 1 in 36. Something has caused an
That's insane.
explosive rise in autism. It can't all just be increased recognition. There's about 200 papers linking the you know uh, ever expanding childhood vaccine schedule to the development of autism, at least being a trigger for it in those who are susceptible. Very, very clear published vignettes of a child who's perfectly well. They come in for a big baby well visit around 1 to 2 years, take a giant battery of vaccines, develop a febrile seizure that night, and then later on are clearly autistic. They start regressing. I mean, those are well described in the peer-reviewed literature. A paper by Nichols and colleagues said that when a child has a febrile seizure in that age range, there's about a 40% chance they'll develop a neuropsychiatric disorder, a permanent one. So Hotez is aware of this. Families are aware of this. Everyone, I mean, this is the elephant in the room. So he publishes a paper projecting. So projection is when you say just the opposite of what you think. So deep down psychologically, he thinks the vaccines did cause his child's autism. And he puts that psychological projection on display for all to see in his book.
Well, there's such a powerful peer pressure not to say what you just said. I mean, I don't think I've ever told anyone that, hey, have you ever considered that autism may be related to vaccines? And I'm afraid. I mean, I have this podcast where I try to speak the truth. I would be afraid to tell that to someone on the street.
Well, I think autism, like most complicated diseases, is going to have determinants. Now, we've never had a giant epidemiologic study of autism. Boy, we should, though. I mean, if this is going to consume medicine, if we don't get a handle on this. So in heart disease, we've had the Framingham Heart Study and the Cardiovascular Health Study. These are giant epidemiologic studies. When I mean epidemiologic studies, I mean, everybody starts out at baseline. We figure out who develops autism, who doesn't, and we study all the factors related.
Well, when it's 1 in 36, that's not that hard to do. That's
Right.
2% of the population.
Right. So what I anticipate, let's say take coronary heart disease. Like there's no one cause of coronary heart disease, but we know cholesterol plays a role, diabetes, high blood pressure, smoking, family history. With autism, it's going to be the same thing. It's not going to be one cause, but clearly preterm delivery is a determinant. Parents who are older age, siblings with autism, and almost certainly childhood vaccination or bad reactions to childhood vaccination. Some kids have no reactions at all, but those who have bad reactions to vaccines will almost certainly be a determinant. And there's 5 studies that have been done showing that if kids take no vaccines, there's much lower rates of autism. Not zero rates, but much lower rates. So, for example, Mawson and colleagues recently published a paper on 49,000 Medicaid recipients in Florida. And about 10% didn't have any Medicare charges for vaccines. They may have gotten it elsewhere, but we're presuming they are, either unvaccinated or lightly vaccinated compared to those who amassed all these visits for vaccination. And the rate of autism in the unvaccinated was 1.1%, but it was 2.9% in the vaccinated. And that was highly statistically significant, a huge sample size. So you get an idea here. And that's one of 5. I mean, there are more. So there's a clinical study by Thomas and colleagues showing his unvaccinated children had a much lower rate. There's like a 5-fold increased risk if a kid takes vaccine. So, the childhood vaccines clearly need to be studied as a determinant of autism. And it's important because autism there's no known treatments for it. There's a tremendous spectrum. Some of it's very mild and the kids are very intelligent and fine. And others, they're homebound, non-communicative. They will require full-time care the rest of their lives. And boy, if we're doing this to ourselves with childhood vaccination, as a society, we better figure it out and quick.
It's a crime against humanity. The CDC nominee, Dave Weldon, withdrew. What was going on there?
Yeah, everyone with all that pregame hype about RFK, everyone forgot about Dave Weldon. He's a former internist, a congressman from Florida. He had raised concerns regarding the childhood vaccine schedule. The word on the street is that the Senate confirmation panel is so compromised and biased towards vaccines. Senator Bill Cassidy from Louisiana, Maggie Hassan from New Hampshire, Bernie Sanders from Vermont, that they couldn't handle Weldon. Weldon would actually know the studies like I do. And so, they could handle Dr. Jay Bhattacharya. Bhattacharya, who's, not a master clinician, nor he's not a very widely published epidemiologist. Bhattacharya gave him the answer they wanted to hear. He goes, well, as I read it, I don't think vaccines cause autism. Okay, fine. Case closed. And they wanted to move on. Weldon would say something like what I said. Wait a minute, this needs to be studied here. And here's the reasons why. And they would have just gone nuts. They would have gone nuts. Cassidy was just berating. He was berating Bhattacharya and saying, I don't want to see another single dollar spent, our precious resources spent on investigating autism and the vaccines. And I was thinking to myself, well, under Cassidy's watch, millions upon millions of dollars were spent on ridiculous research projects with transgender animals and all kinds of perverted science experiments through all these government agencies. And suddenly he's concerned about spending $1 on autism. I got to tell you what, I think Cassidy needs a real reality check. He's a gastroenterologist. He's about my age, very junior in medicine, though, academically. He needs to re-examine where he is on this. Cassidy in 2020 came out with a tweet. He said in 2021, the COVID vaccines have now fully FDA approved. He says that's absolute proof they're safe and effective. Absolute proof? It's obvious Cassidy just doesn't even know what the FDA does. Yeah, there's hundreds of drugs that are fully FDA approved and they're withdrawn because they develop safety problems. So we've got a problem. We've got a quality problem. We've got an experience problem. We've got a leadership problem. And we have a problem of a lack of strength and moral character. I mean, come on. We had Trump 1.0. We had enough COVID vaccine deaths under Trump before he left office. He should have stopped it. Or the FDA commissioner, Stephen Hahn, should have stopped it. Or Alex Azar, HHS director, they should have called an emergency meeting and said, wait, there's too many people dying of COVID vaccine. They had all the surveillance data. So Trump does nothing. That whole team does nothing. Then Biden comes in and they just let it happen for 4 years. Now we've got Trump back in office. They say that everything that's going to be done gets done in the first 100 days. Trump hasn't said boo about COVID-19 vaccine safety. Now he has relieved the burden of mandates in a few areas, but the whole country is fuming over vaccine injuries, disabilities, and deaths, and yet he goes on in a complete oblivion.
Why do you think that is?
I think it's weak leadership. Well, anytime you have a big disaster on your hands, like the COVID vaccine debacle or a war, you never see strong leaders come out and say they were wrong. When was the last time you saw a worldwide leader come out and said, we were wrong on this one? It takes a lot of strength, a lot of courage. If I was president of the United States, I could do it. I'm strong enough. But I don't think he is. I don't think he's strong enough to do it. He's just, have you ever seen him say he's wrong on anything?
A good point.
Yeah, that's a real sign of weakness. So it's like a weak personality trait.
That's the best criticism of Trump I've heard.
When you think about it, I mean, if he was so big and strong and bold, why can't he say, listen, I was wrong and let's move on? That's what everyone knows a strong person can do that. If someone's inherently weak and they're afraid if they say anything, they're going to be pounced on or they're going to be destroyed, then they put up this bluster and they'll never admit they're wrong. Again, that's a defense mechanism. As a psychologist, you can see that's a defense mechanism. Anytime someone's real blustery and very overly assertive and aggressive, that's a defense mechanism for actually being very, emotionally weak, not having much real self-esteem, self-efficacy. So I think it's a product of weak leadership, and we see it all over the world. There hasn't been a single world leader that stepped forward and said this was a mistake.
Have you been contacted by the Trump administration at all? Well, that's a red flag because you seem like the most highly qualified person for it.
Well, listen, these government jobs are not easy. They're very low-paying jobs in Washington. Nobody really wants them. And especially for a physician, a high-level physician or a high-level attorney, there's really tough jobs to take. And, once you're a government employee, pretty much they send you the next email, you got to follow what they tell you to do. So the real power is held by people in the independent media and who are independent experts. Those are the people who have power. I'll give you an example. You know who has a ton of power right now in Washington? Elon Musk. He's not a government employee. He's just a senior external consultant.
That's the dream. Well, it's been a genuine privilege to talk with you. Thank you for witnessing to the truth and for remaining strong. Do you have any last words for our audience?
Well, thank you so much for having me on the program, and I hope you can develop this psychological theme because we do need expertise like yours to examine this, not only individual psychology and defense mechanisms, but also this group psychology, which is very interesting. That gets into sociology. But make sure you follow me on Focal Points. Focal Points is the leading Substack that's addressing all of these issues that we're talking about today. Focal Points, free of charge. Get an email every day. It comes out around 5 a.m. and you'll stay up to date. Make sure that you visit McCullough Foundation, mcculloughfnd.org. Support us in our work, support fellows, all of our work in the courts. And, I've been involved in cases twice now. I've gone to U.S. Supreme Court, all my testimony in Washington and testimony by our epidemiologist, Nick Holscher. Visit my podcast, America Out Loud Talk Radio, McCullough Report. That's Saturday, Sunday, 2 p.m. Eastern. Then it's on the Apple iHeart podcast network. I also do Pulse every Wednesday at 5 p.m. And make sure you check out my book, Courageous Discourse. Courageous Discourse, one of the best sellers from the pandemic genre, written by a best-selling true crime author, John Leake. It's not a boring medical book, but it's a gripping true crime story of what's happened. And for those of you out there who have been searching for some answers with long COVID or vaccine injury syndromes, visit the Wellness Company, twc.health/courage. Get you a big promo discount and check out Base Spike Detoxification with the Ultimate Spike Detox, all the other supplements. We actually have a bundle for long COVID of 4 products. We think this is so common after the vaccines and after COVID that people need to self-manage this with an affordable approach. Not everybody can be going to the doctor and running out big medical bills. So go to the Wellness Company, twc.health/courage. I'm the Chief Scientific Officer of the Wellness Company. Thank you so much for having me on the program.
Thank you, Dr. McCullough.